I have a question for you. A 58-year-old patient presents with recurrent duodenal ulcers, persistent burning epigastric pain, and excessive gastric acid secretion, despite avoiding NSAIDs. His physician prescribed a drug that blocks histamine-mediated acid secretion. So, which histamine receptor is the target of this therapy, and how does activation of that receptor normally lead to gastric acid secretion? You will learn the answer to this question after watching this video. Today, we will be talking about histamine receptors of the Autacoid Pharmacology. In the rest of the video, you will see how quickly and easily you can learn these things. That's enough talking. Let's begin. There are a total of 4 types of histamine receptors. These are Histamine-1, Histamine-2, Histamine-3, and Histamine-4. But in this video, we will mainly focus on Histamine-1 and Histamine-2 receptors. By the way, did the colors catch your attention? Yes, because these colors have a meaning, and we will learn all about it shortly. Now, let's start with the Histamine-1 receptor. Histamine-1 receptor is one of the most clinically important histamine receptors because it mediates the classic symptoms of allergic reactions. Histamine-1 receptors are widely distributed throughout the body. They are found on vascular endothelial cells, bronchial smooth muscle, sensory nerve endings, and in the central nervous system. Activation of histamine-1 receptors in blood vessels stimulates nitric oxide release from endothelial cells, producing vasodilation. At the same time, it increases vascular permeability. Clinically, this causes redness, swelling, and the wheal and flare reaction seen in allergic responses. So, histamine-1 receptor activation is responsible for many symptoms of hypersensitivity reactions, including allergic rhinitis, allergic conjunctivitis, pruritus, urticaria, angioedema. In the airways, histamine-1 receptor activation causes bronchoconstriction, making it particularly relevant in patients with asthma and allergic reactions. On sensory nerve endings, activation produces itching or pruritus, which is one of the hallmark symptoms of histamine release. Within the central nervous system, histamine promotes wakefulness. This explains why first-generation antihistamines, which cross the blood-brain barrier, commonly cause sedation and drowsiness. So, what is the mechanism of action? The histamine-1 receptor is a GQ coupled. After activation, it stimulates phospholipase C, leading to the production of inositol triphosphate and diacylglycerol, which increase intracellular calcium levels. Although histamine-1 receptors are coupled to the same GQ signaling pathway in every tissue, the final response depends on the cell type. So, are you wondering how to remember the histamine-1 receptor? It's simple. So, let's set up the equation then. Histamine-1 equals 3B. Bronchoconstriction, blood vessel leakage, brain arousal. So, let's continue with the histamine-2 receptors. The histamine-2 receptor is primarily involved in gastric acid secretion and cardiovascular regulation. In the stomach, histamine-2 receptor activation increases cyclic AMP in parietal cells, stimulating the proton pump and markedly increasing gastric acid secretion. This is the receptor's most important clinical function. In the heart, histamine-2 receptor activation producing positive chronotropic and positive inotropic effects, meaning it increases both heart rate and cardiac contractility. In blood vessels, histamine-2 receptor activation promotes vasodilation, contributing to the hypotension seen during systemic histamine release. So, what is the mechanism of action? Unlike the histamine-1 receptor, the histamine-2 receptor is GS coupled. Activation of histamine-2 receptors stimulates adenylyl cyclase, increasing cyclic AMP, which activates protein kinase A, leading to the receptor's physiological effects. Although histamine-2 receptors are coupled to the same GS signaling pathway in every tissue, the physiological response depends on the cell type. In gastric parietal cells, increased cyclic AMP activates protein kinase A, which stimulates proton pump, leading to increased gastric acid secretion. In cardiac muscle, increased cyclic AMP enhances calcium influx through calcium channel, resulting in increased heart rate and increased contractility. In vascular smooth muscle, increased cyclic AMP inhibits myosin light chain kinase, promoting smooth muscle relaxation and vasodilation. So, are you wondering how to remember the histamine-2 receptor? It's simple. So, let's set up the equation then. Histamine-2 equals 2 pumps. Proton pump, gastric acid secretion, and heart pump, cardiac contractility. Let's go back to our question. Patient presents with duodenal ulcers and burning epigastric pain, excessive gastric acid secretion despite avoiding NSAIDs. His physician prescribed a drug that blocks histamine-mediated acid secretion. So, which histamine receptor is the target of this therapy, and how does activation of that receptor normally lead to gastric acid secretion? The correct answer is the histamine-2 receptor. Histamine binds to histamine-2 receptors on gastric parietal cells. As you know, these receptors are GS coupled, which activate adenyl cyclase, increasing intracellular cyclic AMP levels. Elevated cyclic AMP, which stimulates the proton pump, leading to increased gastric acid secretion. And that brings us to the end of today's topic. Now that you have mastered the core functions of histamine receptors, it's time for today's high-yield challenge. If you are ready, here comes today's question. Which class of antihistamines is most suitable for a student who needs to stay awake and focused while studying without causing significant drowsiness? I will be waiting for your answers in the comments. See you later.